There are some hormonal coils which we very often use successfully in the perimenopause, but actually in women menstruating. They're really manufactured originally for contraception, but as a gynaecologist, they're most relevant to the women I'm treating in the perimenopause. The Mirena coil is the highest dose coil of these, which is really effective in stopping women having heavy bleeding. And it can also be half your HRT. So in the perimenopause, it's a really neat way of stopping you bleeding, providing the progestogenic component of your HRT, and we can then give you some transdermal estrogen to manage your menopausal symptoms. The Mirena coil can be put in outpatients. We use local anaesthetic to the cervix, so it's not too painful. Women vary enormously in how they perceive the procedure. I always ask women to make sure they've had something to eat before, to take some painkillers before, and then when they come, we can give them local anaesthetic in addition. It's a very quick procedure, but it is a little bit uncomfortable occasionally for a few minutes while it's going in. In some cases, it's a procedure we perform in theatre while we're doing something else. So if you're having a hysteroscopy, if we're putting a telescope in the womb, then we often end up putting a Mirena in. And what it does is it sits inside the womb, it secretes hormones to thin the womb lining and to shrink adenomyosis and endometriosis, which really helps lock down these symptoms. And women often feel much better after they've had it put in. With the insertion of any coil, the main risks are bleeding, potentially infection, although we see this very infrequently. There is a risk of perforation, so occasionally people have been known to stick things through the wall of the womb into the wrong position, but obviously our technique and experience is to avoid that. Once you have the Mirena, for a matter of a few weeks or months, it varies enormously, you may get bleeding in between your periods. This is usually light, and as soon as it goes in general, you have no further heavy bleeding. So if you're someone who's got really heavy periods, it will stop that almost immediately, although for a few months you may have some spotting in between your periods.